Start. The rapid expansion of medical education in India presents a paradox: increasing the number of seats does not necessarily guarantee equitable access to medical professionals. Stop. Over the past decade, the country has expanded its capacity to train doctors, driven by the government's efforts to strengthen healthcare infrastructure, establish new medical colleges, and simplify regulatory procedures. Stop. Yet a proportion of this expansion has occurred in the private sector, where fees are often beyond the reach of families. Stop. Consequently, the numerical growth of medical seats may conceal a deeper problem of affordability and accessibility. Stop. Para. The concentration of private institutions in prosperous urban centers creates another concern. Stop. Students trained in these institutions are more likely to remain in regions where employment opportunities, private hospitals, and professional facilities are abundant. Stop. Rural and economically disadvantaged areas, meanwhile, continue to experience an acute shortage of qualified practitioners. Stop. Thus, increasing the national supply of doctors may fail to address the geographical imbalance in healthcare delivery. Stop. Para. Quality is an equally significant challenge. Stop. Rapidly established institutions may sometimes focus on satisfying minimum accreditation requirements instead of developing adequate laboratories, teaching facilities, experienced faculty, and patient care infrastructure. Stop. Effective regulation, therefore requires not only standards but also transparent inspections, scrutiny of records, and accountability. Stop. Para. The persistence of excessive fees and illegal capitation charges further complicates the situation. Stop. Students who incur substantial educational debt may prefer lucrative private practice or employment abroad rather than public service in underserved districts. Stop. If the government intends to retain medical talent within the country, it must make rural service professionally attractive rather than merely compulsory. Stop. Para. A comprehensive policy should therefore combine affordable education, rigorous regulation, adequate faculty, and incentives for rural deployment. Stop. Better salaries, housing, facilities for families, and career progression can encourage doctors to serve beyond metropolitan centers. Stop. The objective should not be measured solely by the number of medical seats created, but by whether those seats produce competent professionals who are accessible to the communities that need them most. Stop.